because of this pandemic, asakhona ukuthi size sibabone futhi. Ufika manje sibhudu seka emathuneni and urephiwe kufaka amaplastiki nabantwana ba-understand it feels like isiyolahla udodi.
Kubuhlungu ukuthi umuntu omaziyo awukwazi nokuthi uye emngcwabeni wakhona because awazi ukuthi nawe uzobuya sowugula.
Yazi abantu bajwayele ukuthi umuntu nashonile angene endlini mhlawumbe alale bambone noma angalalanga but bavula icoffin bambone. Kepha kusenjalo manje yene esiphethe kabuhlungu into esingayazi yabo.
It hasn't really happened to me, but seeing other families close to me, my friends and friends from who are close to me having to deal with the situation like this, even family members like my cousins having to deal with losing their dad and not being able to touch them. Then when you go to community hall, it has to be less people, like it has to be, we can't all go and mourn with them or be there for them, and to also show like respect for their last moments in this world.
Have you had the experience of a loved one hospitalized for COVID-19? How was not visiting to them, not speaking to them when they needed you the most? Have you buried a loved one who has died from COVID-19, and how has the experience impacted your life? Hello and welcome. I'm your host, Dr. Musam Tomene, and signing with us today is Nono Nyovana. On Vital Signs, we focus on the impact of COVID-19 on mental health, dealing with death, dying and grief. And coming up on the program today, we speak to Zama Butelezo, who then spoke to a woman about her experience with losing a relative. We'll speak to a clinical psychologist about the impact of losing a loved one to COVID-19, and we'll also speak to specialists about wellness counseling, and that is also looking at the importance of grief counseling, and we'll speak to a well-known prophet about the experiences with bereaved families struggling to find closure.
Do you want a bank that puts the expert
on SABC? Remember, you can be part of the show by asking some of our guests the questions that you have on your mind by simply sharing your views with us as well about what we're discussing. The number to call is 011-714-5861 or 011-714-5877. We're also on social media, so you can share your thoughts with us. It's at SABC Vital Signs on Twitter, as well as SABC Vital Signs on Facebook. Of course, we're going to continue our discussion now. This is the show that you know and love, that gives you all the information as we talk about all things medically related. Now, some people may experience multiple losses during a disaster or large-scale emergency event. Because COVID-19 is a pandemic, you might have been unable to really be with a loved one when they died, or unable to mourn someone's death in person with friends and family. Other types of loss included unemployment, or not making enough money, or the loss or reduction in support services, and other challenges, and of course changes to your lifestyle. Now, these losses can happen at the same time, which can complicate and even prolong this grief and delay a person's ability to adapt, heal and recover. Now, people cope with losses in different ways, and Zama Butele spoke to Portia Rashalala from Soweto about her experience with her uncle's COVID hospitalization that resulted in his untimely death.
First time I heard Guti say hospital he was admitted, it was after the president announced Guti it's level 4. So it was on Sunday, Monday yakona mabesho ukuthi he was admitted. I was so shocked because ngamgcina last week yakona, and I was like, no, I don't think ukuthi u-admitted for COVID.
Still shocked at the news, the family had more sad news coming.
We heard that his wife is also admitted to the same hospital, and then like lento ukuthi how kwenzakalani manje, like boy too, and then how babayithole kanjani corona, like sesizibuza imibuzo, and then saqala ukuchecka lapho ukuthi actually this thing is serious, ukuthi vele umalume une corona, cause angithi kuyashiwo ukuthi corona the way it spread ngakhona, like you can't sit on the same room, into ezinjalo ma isolation, so ukuthi baye bathelelana, that's why maybe they are in the same hospital.
Feeling helpless and not able to visit their uncle in hospital, this family could only hope for the best.
Everyone was hoping for him to get better. And then uhlale 2 weeks, and then lapha qeda ukusho khona ukuthi guys, I'm fine, sebangicheckile bangitestile bathi corona iphelile kimi. And then all of a sudden Monday morning sitholi call ukuthi like he has passed away. Not futhi abasathi corona bese sekuthiwa through lung infection.
Preparing for a funeral during lockdown made the situation even worse for this family.
Bekumele bamenzele ne-memorial service. The memorial service azange bayenze, abantu bebayibukela through ilena, bebayenze bebashithe ivideo khona lapha endlini ukuthi okay kuzoba nabantu abayi-10 lapha egaraji, angeke kusaba khona abantu abaningi because he was working for a big company. So lento yokuthi angeke khona ukuthi kungena abantu abaningi lapho, kuzoba nje some few people laba bayi-10. And then nange funeral he was supposed to come back at home njengobaba umuzi azokhona ukuthi alale endlini. He didn't come back. At the same time bebathe i-corona isekho, so like it was confusing ukuthi kahle kahle i-corona leyo or leyo lung infection eyenzekile or ini.
This experience has left the family confused, and not being able to grieve properly hasn't helped.
As a family, I think isenze ukuthi after the funeral like akakahlangana kuba ngathi khona into lehlekile or eyenzekile, or kuba ngathi khona umuntu ongablameiwa ukuthi uwo yenze kanje or like sokhona nje ukuzwana okungekho. And then nami nokungifikela inokungihonta like lento ukuthi how like this guy akasekho vele kwamampela emhlabeni, like lento ukuthi kuba ngathi usase lapha esibhedlela or uyovakasha uzobuya futhi, and knowing very well ukuthi akasekho vele like ushile kwamampela.
Grief is a unique experience for everyone. Losing a loved one to coronavirus disease may have made the grieving process even more challenging. Clinical psychologist Dorothy Malimela talks to us about something that many of us do not want to think about, yet maybe even be worried about the fear that comes with the panic of having such a thing happen at such a time, and that is losing a loved one to COVID-19. Good day, Dorothy. How are you today?
Good day to Dr. Musa and the viewers at home, and thank you for having me.
So let's jump into it. Death and dying. Why is death and dying such a complicated process?
Losing a loved one is not an easy process or an easy emotion to undergo through, because most of the time, these people that die, particularly parents or a close friend or a colleague, they have a significant meaning in our lives. So sometimes when the person dies, they leave us with sad emotions. We become extremely angry. And if the person was a caregiver in our homes, now we are left with many losses, because now it's loss of financial income and also other losses. So it is a very, very difficult process to undergo through. It is a very painful moment for families, for rather people that lose their loved ones.
Now, before we get into the families and the people that are dealing with the death of a loved one, I want to talk slightly and a little bit about the psychology of dying as a person who is sick. So, I mean, a lot of us have had that fear where, you fear going to the testing station so that they can put the nasal swab in to give you a COVID thing because you've been sick. And you find yourself in a hospital, and the psychology behind being sick and the fear of dying, how does that come into play?
When a person is hospitalized in the hospital with COVID-19, it has a major psychological impact on the person, because most of the time these patients are likely to feel extreme sadness. They are likely to feel extreme loneliness when they are in hospital because of the restriction put that families cannot even come and visit. And it also impacts the cognitive functioning of the person. As you are preoccupied with the thought of having this virus, especially when every day you are not progressing, you are not getting okay. So now it even exacerbates your anxiety. At the end, you even fear dying, you even anticipate your own death. So it has a major toll on a person who has been hospitalized. And most of the time, we see these clients experiencing loneliness and lack of support from their family members. Because if you can check, sometimes our support is non-verbal and requires people to have physical interaction. So when that is restricted, it makes the situation worsen to a person who is hospitalized.
For these people that have been hospitalized and eventually got out and are discharged at this point in time at home, are there lasting effects or after effects of having had that period of prolonged loneliness, of prolonged, illness, of being in this hospital, not having family members come in to give you that physical sort of, get me up? Have there been effects that you've recognized?
Yes, normally people that present in our facilities, they will present with depressive symptoms, and most of them also present with anxiety symptoms, because they live with fear of what if I become diagnosed again, and what if I die? What if maybe one of my family members die because of these things? So there are major impact, and also we also see these people also presenting with obsessive compulsive symptoms, wherein they frequently wash their hands. They are always looking into making sure that their places are clean and everything is intact.
And do these sort of things, I mean, you mentioned obsessive compulsive or anxiety type disorders that you're seeing in the practice, as well as depressive type things. But to the common man, what does depression look like? What has that depression presented as at your practice?
Depressive symptoms vary from one person to the other, depending on the cause of the depressive episode at the time. But there are similarities of symptoms that people present with. Like in most cases, these people will present with extreme sadness, they will be fatigued, they will lose appetite, they will also present with significant weight loss, and they will also complain about not functioning very well in their work environment, or rather their social functioning is impaired. And in extreme cases, we see these people presenting with suicidal symptoms when they come into our practices.
Okay, so we've spoken about the people and the effects that they'd have for those that have survived COVID or were, in hospital for a prolonged, time. Let's touch on the families at this point in time. I mean, they surely are presenting in a different type of way when they've lost a loved one. So what have you been seeing in practice?
In our practice, we have seen a lot of people presenting with grief symptoms, because when their loved ones are hospitalized in the hospital, they become frustrated, they become irritable, and some of them, they also show symptoms of depression and even worry about the death of a loved one. And some of them will also present with a fear of dying themselves, because when they think about somebody who has been hospitalized and is in hospital, they now think about who is going to die. Am I next? Am I going to die? So those are some of the things that we see in our practices.
Okay, we've got a call from Trisha in Pretoria. Good day, Trisha.
Hello.
Hi, Trisha.
I'm good, and you?
We're well on our side. What's your question?
Sorry?
What is your question, Trisha?
Oh, for me, I wanted this thing to be more different, because I feel like when we bury them, we bury like a dog or something.
Are these, is
because
this...
Sorry?
I'm asking, is this what you felt when you've had to bury a loved one, where you feel like that personal relationship doesn't seem to be there? It's as if you're disconnected from the person you're burying.
Can you please repeat the question?
Angeri Trisha, you're saying that the issue with burying people, especially during these COVID times, has been that it feels like, in your words, you're burying a dog. What has that been like for you? Is that what you've personally had to experience?
Yes, I did. Mama, like, you know this thing, the day before the funeral. Re tlhapisa, re mone la di last. For me, into I ran because of by the haboniwi, hasolo tlhapisiwa, and la ha bua ma ha tsena mo jarateng o felletse ko strateng. So ke fito ka re like ke yone irang gore ke sa bana le closure because di ka mokhomo.
No, Trisha, thank you. We'll ask the question and you'll get it answered, okay?
Okay.
All right, thank you. So the issue of losing a loved one and not getting the closure that you expect. I think as a lot of people in this country, there are rituals, there are cultural things, there are just ways in which we've learned to deal with death, and COVID taking that away from us. Have you experienced a lot of closure deficits, or people feeling like they haven't reached closure with this person before?
Yes, honestly, Dr. Musa, that's a very good question, because in our African culture, people perform these cultural rituals so that it assists them in dealing with a loved one, and it also assists them in dealing with issues of grief. So when that is being taken away from these people, it worsens grief symptoms, and it might even lead to complicated grief, which is extreme, wherein people will be presenting with anger outbursts, and some of the people might even end up engaging in self-destructive behaviors like cutting themselves and also having long-lasting anger.
Okay,
Yes.
Dorothy, we're going to continue this discussion, and of course, this is the end for this discussion right now. We're going for a quick ad break, and we'll continue our discussion with Dorothy around death, around dying, around grief, and how we can get closure with the death of our loved ones. See you now.
You'll be surprised at how little you could pay for car insurance. Like Tabiso, who pays just 510 Rand a month for his 2020 Ford EcoSport. What are you waiting for? SMS car to 44211 or call 08600 60,000 today for great premiums and awesome service from a brand you trust.
Yeah, it's very hot. Like, I also just have my tongue out all the time because it's hot.
I've tasted sushi in different parts of the world.
Welcome back. This is Vital Science. I'm Dr. Musa Mtombeni, and we continue our discussion with Dorothy Malimela, a clinical psychologist, and we're talking about death, dying, and dealing with all of it. Dorothy, we're back, and before the ad break, we were touching on the idea of closure. Is there a way that people can get closure even though they've buried their loved one, where you physically can't do anything anymore with respect to, the washing of bodies or, holding their hand for the last time? How do we deal with closure at this point in time?
Because COVID has affected us in many ways, wherein we cannot find closure properly by seeing our loved ones before they pass on. What is important is that we need to attend these virtual memorial services. They assist a lot in the grief process. And also we need to acknowledge how we feel about the death of our loved ones, because most of the time people try to act strong. People don't express how they feel. They don't even want to talk about their emotions. So we need to express how we feel. No matter where we are, we need to start to talk about the impact it has. If we are feeling pain, we need to normalize that being okay is normal. And we need to start talking about it. So that is what is going to assist us. And people can also go through albums of the deceased person when which will assist in finding closure, and also share memories they shared with the person who has passed on, focusing on the positive memories, the good memories that these people has shared. It also assists in finding closure, and also knowing that grief is a process and we need to be patient with it. It might even take a person years or even some months, depending on the significance of the person who had died in that person.
Is there such a thing as too much grieving? Is there such a thing where, you find yourself crying every single day about this person numerous times a day for months on end, and you feel like you're just not reaching the point of, getting better, in inverted commas? Is there such a thing?
Yes. Remember, grief is not linear. And as you've mentioned, grief is unique depending on and everyone. So some people will cry almost every day, and crying helps in accepting the death of a loved one. Because we are different and we grieve differently. There is no linear way of saying this is a proper way of grieving. We grieve differently, and it is okay to acknowledge the symptoms of grief. However, when it becomes extreme, when people don't grieve, it even exacerbates to complicated grief.
A lot of people, lost a loved one. And whenever we talk about these sort of things, it's always the adult perspective, that, you lost your brother or your mother, and we look at an adult perspective. But there are also young children and adolescents that, have also lost someone. So in practice, what have you been seeing this loss and this abnormal grieving appearing as when young children have to deal with death, dying, as well as grief?
Most of the time, yes, we focus on adults, on grandparents when they are grieving. And grief goes as far as affecting children who are even 4 years old. I think the youngest that I saw in my practice was 3 years old. Sure. She was grieving for the loss of the parent. Remember, grief, it's not death only. You grieve for any type of loss. It can be loss of a parent, loss of a job, and even parents divorcing. So with children, because of their developmental stage, they normally manifest their grief through behavioral symptoms. And most of the time, what we observe in our practice is that they present with tantrums, they become irritable, and they also change their behaviors in school. And most of the time, we see this certain changes in the academic performance. So normally the teachers will be worried that, no, this child is showing symptoms of withdrawal, because most of the time they will isolate, they will have tantrums, and also they may start bedwetting as a sign that they are grieving for a loss of someone. So we need to also take note of some of the behavioral changes that we observe in our kids, so that we get necessary assistance to them.
I mean, 2019, 2020, and I guess 2021 have been very different to a lot of people, with losses coming across the spectrum: employment, emotional losses, and of course, the loss of loved ones. What are some of the healthy steps that we can take in order to reach a point in which we've grieved successfully or sufficiently and in a healthy manner?
We need to start in our homes. We need to provide spaces wherein people can talk about how they feel. They can talk about the pain caused by the death of a loved one. And as parents and as family members, as community members, we need to also start providing that therapeutic space, or that space where people can be able to express their emotions, and when they are feeling sad, and not regard them as being lazy or as being weak. And we also need to educate ourselves with symptoms of grief and also some of the mental health disorders that affect people, so that we are able to even assist these people to get necessary assistance. And when we understand that, then we can be able to refer them to psychologists, we can refer them to counselors, or even spiritual pastors, wherein they can be able to get assistance. And some of the strategies that people can use, they can engage in exercise, they can practice self-care practices by meditating and also talking about their feelings, and also journaling, as I've mentioned before.
Wow, talking about feelings, such an important one. And I think with that, we know that talking about feelings doesn't necessarily mean I must come see Dorothy and sit with Dorothy and we must talk about how I feel. It's speaking to someone that you know, you trust, and possibly even love, that will share and understand what you're saying to them about how you feel. Thank you so much, Dorothy, for joining us today as we spoke about death, dying, and how we can deal with it. After the break, we speak to Cynthia Siepe, who is going to tell us about grief counseling and how we can better that to make sure that we deal with grief in a healthy manner. See you after the break.
All right, so much happens behind the scenes that I don't think people know what happens. What's your favorite part of the day?
Maybe the regular.
Welcome back. This is Vital Signs. So for those that have lost a loved one during the pandemic, it may be harder to grieve. Some people feel like they've been deprived of the ability to really grieve, and one might feel like they're in a state of limbo, as though the loss didn't really happen. Making the decision to consult a grief counselor is not an easy one to make, especially when you're actually grieving. So it's understandable if you're initially quite skeptical about this idea of grief counseling. However, you don't have to reach a point of severe levels of grief in order to opt for grief counseling, and it helps to consult a grief counselor even if you're merely in a space where you need just to talk without that fear of being judged, or just feeling the need to process those emotions with someone else. Cynthia Siepe is a specialist wellness counselor who talks to us about grief counseling. Good day. How are you, Cynthia?
Good day. How are you, Dr. Mtombeni? And thank you for having me.
Great stuff. So let's jump right into it. What is grief counseling?
Okay, so I'll start by briefly defining grief again. Grief is a state of deep sorrow over the loss of something or someone. Examples including death of a pet, ending of a marriage, and death of a loved one. So grief counseling is meant to help one to cope and manage their grief in a healthy way.
Are there stages to grief? Is there a pattern that one generally sees when you are talking about, the loss or the sorrow that you feel when you have lost these loved ones?
There are stages of grief that are generally accepted, but I'd like to mention that these are not set timelines for everyone to follow. So some people might not even experience some of these stages, but the generally accepted stages are 5 stages of grief, which are, the first one would be denial, where one is still in a state of shock and disbelief, as we had earlier with Portia, where they still hope to see their loved one. They still hope that somebody will wake them up from this horrible dream that they're having. And the second stage will be the stage of anger, which might be directed to the higher power, the doctors, the paramedics. It might be directed to the loved one who has died, especially if they've left young children to be taken care of. It might even be directed to the grieving person themselves if they feel like they could have done something to prevent the death from happening. And then we've got the third stage of bargaining, which is directed also to the higher power, where one tries to negotiate with the higher power for a totally different outcome. And fourthly, the person will slip into depression. So as they start to realize that their loved one is gone and they're not coming back, they start to lose hope, feel helpless. They don't see the point of planning for the future. They might also struggle to talk to people, where they isolate themselves. They stop taking care of themselves physically. They just can't get out of bed. They don't see the point of going on. And then the final stage is the stage of acceptance. But this does not mean that the pain goes away. It means that the person has accepted that the death has happened and they are now ready to live and move forward.
So COVID has come with a lot of death, whether it is direct with, losing a brother, sister, a mother, but also indirectly, colleagues and people such as that. Are you seeing a lot of people coming in requiring grief counseling?
There is a balance. Although there's most people that come due to having lost their loved ones due to COVID, there are also people that come because of other factors. But the COVID rules and restrictions are having an impact on how they bury their loved ones.
Mm-hmm. How has that manifested itself?
It has really delayed some of the processes of grieving because, as we've heard earlier, with them not being able to see their loved one being buried or to see them in the coffin, it delays the process of them accepting that their loved one is gone. And they struggle also with closure and the fear and anxiety of not knowing if they will get COVID tomorrow or next week and if they might be the next person to die.
Mm-hmm. So how does grief counseling work in that regard? I mean, is this something that, someone writes a referral for this person to come see you? Or, do you get families that just bring along a family member because they feel they're not dealing with this? How do you generally see it?
Okay, so most people will generally make the call themselves for an appointment to come for grief counseling. Very few people refer their family members. They'll either make an appointment for them, but it's the onus is on the person to come for the counseling.
Are you seeing a lot of people, and who are you currently seeing with respect to grief counseling? Is it, is there a bias with respect to the people that come in for grief counseling? The theory in the community is, a man must be strong and, he can't go out and get counseling, he must just deal with it. Or in practice, do you see an array of people across the spectrum?
There is an array. I see both male and females, and the age groups from teenagers to adults.
Okay, so that's a big spectrum that you're covering there. So what are some of the techniques that you'd use in grief counseling? What and how do you prepare someone to deal with the 5 stages that you've outlined, moving from a point of denial to a point of acceptance?
Okay, so I'd also like to mention that there's various techniques that are used, but with all the techniques, mostly the steps that will be followed is that the person will be allowed to talk about the death in detail. So as they talk about the death in detail, then they start realizing that the death did actually happen, and then the grieving process can start. And also the person, there need to be where we distinguish between grief and trauma. So if the person is still stuck in a state of trauma, the grieving process cannot start. For example, if they still have flashbacks about their loved one dying in their arms. So until the trauma is being dealt with, the grieving process cannot start. And then also the counseling sessions will help one to deal with the guilt and to also organize their grief.
How does one recover from trauma? I think a lot of the time, the example you used of, of a loved one dying in your hands has kind of fallen away over the past year or two because, due to COVID, where you won't necessarily have that happen. How do you deal with a trauma in that sense, where you won't necessarily have a flashback of the person dying in your hands, but you've got maybe a flashback of the memories that you have with that person? Is there room to get help in you still having flashbacks of your time with this person?
There is room. So before the grief process starts, or before the grief counseling process starts, then the trauma is being dealt with, where all the emotions and the emotions that the person is having are dealt with, the root cause of the emotions and where they are stemming from. So you might find that with other people, the recent death has triggered some emotions of losses that happened previously that were never dealt with. It might be a death that happened a year ago or 2 years ago. So this recent one has triggered those emotions. So that has to be dealt with, and the person has to be taken through those emotions and be taken through their own path to healing.
You mentioned acceptance and how, this doesn't necessarily mean that, it's over now, that it's a thing that happens over time. How does one recover in terms of grief? When do you feel is the right time to discharge a patient who's come to you to see you for grief purposes?
Okay, so with grief, as we've heard before, there is no time limit. Grief is unique as a fingerprint. So people grieve differently. And one should be allowed to grieve at their own pace and in their own way. Okay, but as the person recovers from grief, you will see them by accepting that the loss has happened. And what will happen is that they start acknowledging the pain and the emotions that are coming with the grief. They will start to learn to deal with their, to deal and manage their grief. And then they will be ready to carry on living their life without the loved one.
How do we deal with life after grieving? You know, life after losing a significant person in your life. What's the next step of that process?
Okay, the most thing that people struggle with is finding meaning after they've lost their loved one. So this is where one asks themselves whether they should even worry about planning about the future. What is the point of me carrying on if I'm going to die also? So one can start into looking at lessons that they can learn from the experience and try to grow from the experience. And when with other people, it might be using this experience to educate other people. For example, someone might start a website where they educate people about COVID, or someone else might start a support group for families that have lost their loved ones for COVID. So it also drives now the person into trying to celebrate their loved one in a positive way.
Why is it important not to rush through the process of grieving? What are some of the bad things and the bad outcomes that come from that?
One might end up having troubles with substance abuse. They might have mental illnesses. They might have physical health issues. And they might also have strained relationships, both at work and at home.
Why is it important to celebrate a loved one? I think, you know, in the climate that we find ourselves in, where you can't go to a funeral because in a way that's celebrating that person's life, where people would maybe even have an after tears after that. But with COVID coming into the picture, that doesn't necessarily happen. So how do we increase our feelings of love and deal with our grief by celebrating the life of someone that has passed?
So celebrating the life of the loved one that has passed on helps one to live their life without guilt. It helps them to grow from the experience. So people will do it differently, depending on how they believe that their loved one would have loved to be honored. So for person A, it could be starting a foundation in the name of their loved one who has passed away. And for person B, it could be just living their life according to the standards and principles that their loved one passed on to them. So a person will start by determining how their loved one would have loved to be honored and take it from there.
All right, before you go, we've got a caller. That is Ngateko from Limpopo. Ngateko?
Yes, mister.
How are you, sir?
I'm good, thanks, and how are you?
Good, thank you. What's your question?
You've been married for years. Is it possible that someone can move on in a space of 12 months after losing a loved one?
If you've been married, did I hear you correctly? Okay, so Cynthia, the discussion here, and according to the description you gave at the beginning, is around the idea of grief, and is that, you know, I know you mentioned pet, a relationship, and of course a loved one. So is it possible for someone to move on very quickly after, you know, the demise of a relationship?
It's possible to move on. That's if they've went through the necessary emotions that they need to deal with. If they are not suppressing their emotions and they have dealt with their emotions, it is possible, because remember we said everybody grieves differently and there is no timeline. So as long as you are not suppressing those emotions and putting them under the carpet for a later stage to deal with them, then you can safely say you have moved on.
All right, wise words. Thank you so much, Cynthia, for joining us today and really getting into the crux of what we're discussing, the issues of grief and how we can do better with managing that so that our grief is not abrupt. Our grief isn't something that ends or starts quickly, but is dealt with in a healthy manner. Well, great discussion that we're having today, and of course, you'll continue with it after the ad break. We'll see you after this. Certain aspects of grief are virtually universal. Most cultures have rituals of mourning after a death. Crying is common, regardless of a person's origins. However, the bereavement process can vary dramatically depending on one's culture. For many people, of course, the days and the hours at the end of one's life are especially important. Normally, we are there to hold a loved one's hand and have a meaningful conversation and affirm the bond that we have with them. But importantly, a lot of people actually find that time to make amends. But COVID, of course, has prohibited us from doing this very thing. As a result, many people die with a broken heart and families are left without that very important closure. We have Prophet OJ Madiko. He'll talk to us about the experiences of bereaved families struggling to find closure. Good day, Prophet. How are you today?
Good day, my friend. I'm okay. I'm right under the blood of God Jesus Christ, and I love you all, good people.
Good stuff. Right, so let's get into it. You've had to deal with families and bereavement during COVID. What has that experience been like for you particularly?
Well, it has been painful. I can tell you that even though I've been doing this counseling for many years, but I can tell you it has not been an easy going really for the past 2 years. And you know, you counsel a person who has gone through that. And you must not even forget that even I personally had gone through that pain of losing people very close to me through this pandemic and so forth. So the pain is very, 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 very severe. And it is not an easy thing. When you have got to take 5 minutes with a person, you find yourself taking almost 30 to 1 hour, 1.5 hours, because it is not easy really. You must remember that a human being is actually divided into 3 parts. It is the you part, which is the flesh, the man part, which is the spirit, and the soul part, which is the what's called the soul. And that soul part is actually the synchronizer between the man part and the you part. So you work very hard to pass the you part and the soul part go to the man part. That is why it is not really easy, because that is why it had the most. So people coming, you find a family coming. These people are telling you, like recently I had a family where the mother and the father died at the same time through COVID. And then we had to deal with the kids and the whole family. It was very, very painful. And that experience and that ordeal, it even hurt you who's doing the counseling. You feel the pain as if you put yourself in the shoes of those people. And you try by all means to find how deep has this thing gone into the man part of the component called human. And when you have found that, then you can at least try to find as to how you can reach out to that person. So you find the person saying to you, I've just buried my loved one, and I did not even see the corpse. I'm not even sure at the moment if the person I buried is really my son or my father or my daughter or something. It had even most painfully there. So these are the experiences we find ourselves going through almost on regular basis, meeting people who have lost their loved ones. Very, very painful, my friend.
There are a number of rituals, and I think we live in a society where, you know, each cultural group have got their small little things that they do to celebrate and go through the process of mourning with someone. But COVID has obviously taken that away from us. Have these things impacted how families bereave or deal with the mourning of someone?
Terribly, my friend. It has teared many hearts apart. You know, by just burying someone whose face you did not see, that one alone terrorizes the inner person terribly. By having to run a funeral, preparing for it alone or with just few members of the family, when you are supposed to be having relatives and other people coming for night vigils, consoling you, comforting you, you know, with those words of theirs, that thing is not there because of COVID-19. You can imagine, you know, you are the whole week, you are preparing for the burial of your loved one, and your cousins are not there, and the neighbors are not coming, people are not coming. Only few people can come according to the regulations of COVID-19, and then you find that wound going deeper, because people who love you cannot take the route with you up to the day of the funeral. So normally we used to see people having to spend the night with their loved one before they bury him or her the following day. COVID-19 says, no, you can't do that. And that used to be a healing, part of the healing process of the bereaved. That used to be a part of the closure for those that are left behind. COVID-19 has said, no, not that. You know, people, when they go to the funeral, when you are burying your loved one, you cook for people. And COVID-19 said, hey, come on, only 50 people can come, and from the grave, you take snacks, you go home. And that practice we grew up seeing in some other cultures, say with the white people. It was never an African thing. In our African culture, we don't have that, because when we grieve, we celebrate at the same time. We cook food. When we are happy, we cook food. When we are whenever we meet, there's a lot of food that we cook.
Yes.
So COVID-19 said, you bury, you don't slaughter a cattle, you don't do this, you don't do that. So those practices, the cooking for people is a ritual on its own.
Yes.
And it heals. It heals because you have lost your loved one, but it gives you a chance again to share with other people the piece of meat you have prepared for them. That alone heals the inner person.
All right, Prophet. We've got a call here from Gladys. Gladys, good day.
Hello,
le kae mama? Re teng mama, re mametse, potso ke eng? Re mametse mama, nkana bu? Ee mama.
Ke re ke na le problem ka mayana sana. Re mo moyeng.
Re moyeng mama, ee.
Ke tsa sa ga ile go o mametse wa itse.
Ska sebisa lebitso la hae and re lebitso la se le lebetse vele bua re mametse.
Bothata ke dithutse le ditla tsa ke. La ka mme ga mamela ha re continue ka sa gona bothata.
Asebile.
Na le e yana sister e le re o ineletse mo jwaleng wa itse a di sa itse le re ke tse.
Re mametse.
So ga ke itse gore maybe e khotse go ba grief e maybe ha dula le yona o tlhokofala ba tswadi sa le monyane. Ba nne wa rona o tlhokofala 2003. Tato wa rona tlhokofala 2010. Ausi wa rona tlhokofala 2011. Yana jaanong ga tlhokomele ngwana o dula le go dithatse.
Okay. I think ga you question now ke tla botsa prophet o mamele re tla fa answer o.
Okay.
All right. So basically, the caller calling in there, prophets, to underline the issue of grief, how when it is not dealt with, it manifests itself in different ways, highlighting that, you know, a sibling of hers has had, the mother passed away, the brother passed away, the father passed away, and has then fallen into substance abuse. Has this been, and is this an issue that you see with families that don't mourn properly or find themselves, bereaving in the right environment?
Especially young people who grow after they have been struck by such a grief. Some of them wouldn't even ventilate. And then it happens today. After 2 or 3 or 4 years down the line, this person starts feeling the absence of that person because he or she used to get some support of some kind from that person. When that support now starts showing that it is not there, so this young person now starts worrying about where to now, how to get 1, 2, 3, 4. And that is what we have identified in the lives of many young people who, a year or 2 or 3 or 4, lost their next of kin or their parents or people who used to support them. It pains mostly if a person starts now flashing back to the things he or she used to get from that person who passed away. And those things are no longer there. I can tell it terrorizes the mind of a young person. And it needs very, very careful counseling there. It needs a love. That is where now the question of love comes in. Because
Prophet, I'm going to have to jump in there. We're out of time, unfortunately, and we have to go. But I think what you just said last is very important. This stuff just needs love. Sometimes it requires love. And thank you so much, Prophet, for joining us today and giving us really a perspective on community and how rituals and things such as that have been important in dealing with grief. Thank you so much for joining us on our episode today, where we spoke about death, dying, grief, and dealing with the loss of a loved one, especially during the times of a pandemic. Stay at home, stay safe, and of course, social distance. I'm Dr. Musa Mtombeni. We'll see you soon.